Hi, this is Dan Hoost, the Communications Director for Sullivan County Government. I am here with Nancy McGraw, our Public Health Director, who has been at the forefront of our response to COVID-19 in Sullivan County. And we want to bring to you these regular little updates on what's going on with coronavirus in Sullivan County, especially as we're seeing numbers increase. Nancy, as of today, November 18th, 2020, a Wednesday. What are the current numbers that people should know?
So what people need to know is that our cases continue to increase, and markedly so in the last week or two. We've gone from just 35 cases about a month ago to 128, I think it was yesterday, 127. Some of those active cases have now gone off of isolation and have recovered, so we're back down to 118. However, that number is continuing to gradually increase, and that's following similar trends from um, the rest of New York State and the rest of the country. So we knew going into the fall that this was a danger and a risk, and we did expect this as more people started going indoors and also having gatherings. So luckily, we have not seen any additional deaths due to this virus. We do, however, have 488 people in quarantine. So what we are seeing is that for every positive case, where there used to be maybe just a few or a handful of other exposures, possibly close family members or coworkers or friends, that now we're seeing on the average of 10 to 20 exposures per positive case. So that means that there's community wide transmission and spread, and that people are much more active in the community. More people are working, schools are open, we want them to stay open. So, in order to get really control of this and try to prevent additional spread, we all need to be very, very concerned and um, use our prevention measures in terms of what we know works, which is wearing our masks, washing our hands, and keeping at least 6 feet or more away from others in the workplace, in public, at school, wherever you are, because that will greatly reduce the risk of transmission. Social distancing is not a replacement for wearing a mask. You need to wear a mask if you're 6 feet from someone, because if you're both wearing a mask, that significantly reduces the chance that the virus will be transmitted from one person to another, because the droplets in the air are still there. So you don't know if somebody's necessarily infectious with the virus. People can be asymptomatic and not even know that they have the virus, and that's why we've seen a lot of transmission recently in the community. And so we just ask people to, regardless of your beliefs in terms of information that's being spread out there about whether masks work or don't work, please understand that they do work. It is prevention, is public health, evidence-based science that masks do work. Now, different types of masks are more effective than others. So we have that information on our website as well, and please go to credible sources for your information or call our department.
As you can see, Nancy is wearing a mask. You can't see me behind the camera, but I am wearing a mask as well. Even though we know each other well, we've worked many years together, and we trust that each other doesn't have coronavirus. We don't know that for sure, which is why we're taking every precaution, even here while shooting this video. Now, Nancy, speaking of the numbers, people have noted that sometimes they look at the state's dashboard and they see their numbers don't sync up with ours. Why is that?
There are sometimes discrepancies, and we notice that as well. When you have different data sets, um, they're never going to match perfectly. It's also a timing issue. Um, we get at the local health department level batches of lab reports, and we get them twice or sometimes several times a day. And they come in large batches of positive and negative lab results, and we only have to sort out the positives. That's what we have to follow up on quickly and contact people to let them know if they haven't already been contacted by their healthcare provider that they are positive and they need to isolate. Actually, they should have been told to isolate at the time of their test and to go home and wait for those results. We don't want people wandering around in the community waiting for the test result, and then oops, they get a call that it was positive, and between the time you got the test and found out your result, it could have been days, and you would have already exposed many, many people unknowingly. So that's very important. Back to the data. Sometimes people get tested out of county at other healthcare providers, at state testing sites, and so those lab results take a little bit of time to get to us, so our numbers may not always sync up right away. We also have people who live or who work in Sullivan County who live in other counties and sometimes even other states like Pennsylvania and New Jersey, and they commute up here for work. The lab results go to their county or state of residence, so we may not necessarily know right away. So those numbers may not match up in real time. They're not going to match up in real time, and we will have to transfer some of those cases out to their county of residence.
Now, you had talked also about isolating, quarantining, and this week we put out a press release about the difference between those two. But for those who haven't seen it or those who just understand better when you're talking face to face, can you explain the difference?
Sure, I know it can be confusing because sometimes we use the words interchangeably, but there are differences definitely between isolation is when you're sick. Quarantine is if you've been exposed to somebody who is either sick or who has tested positive. They may not be sick. It takes 2 to 14 days when you've been exposed to someone with a positive test to develop infection. So that's a quarantine period. That's why it's up to 14 days. And the average time, if somebody's going to develop infection as a result of being exposed, the median time is around 5 days, anywhere from 3 to 5 to 7 days. However, the best research out there, and this is supported by the Centers for Disease Control and the World Health Organization, is that someone can convert to being infectious and convert to a positive test on the 14th day, and that has happened, although it's sort of an outlier. So quarantine for 14 days is really important, that people, even if you're feeling fine, you can still be infectious without being symptomatic and transmit that virus to others who are high risk. So high risk being, people who have health issues such as diabetes or hypertension, or are significantly overweight, or asthma, or they have an immune compromising condition, they're on chemotherapy for cancer. Or elderly people are very much at higher risk if they're in these groups. Isolation is a 10-day period, and that's for somebody who tests positive. And the isolation goes back to 2 days prior to your positive result or the onset of symptoms. So that's when you will get a call from the health department, and they will ask you some questions about when you started to feel sick, who were you around in the previous 2 days, 48 hours, where were you, to help our staff and our team do our contact tracing to let as many people know as possible about their risk of having been exposed. That is how we try to contain an outbreak and to prevent additional cases. And as you can imagine, it's very time consuming, and sometimes it's only as good as the information that people give us. So it's very important that people in the public are honest with us and forthcoming with information. We want to help, and we want to help keep our communities and our businesses open, our communities safe, our schools open. So that isolation of 10 days is when, after the 10th day, if somebody has tested positive, we can be very certain that they're no longer infectious and they can be released to return to work or school or go about their business.
Last question for this session is what do you think or know is going to happen if active case numbers keep rising?
Well, our concern obviously is that, the number one factor is that we want to not overwhelm the healthcare system with our limited hospital bed capacity in a rural county. Many other, states in the Midwest are really having a difficult time with their hospital capacity. In some states, they only have, number of beds that we would have in our whole county. So we're very fortunate to have a pretty well-functioning and good healthcare system in New York State, but it doesn't take a lot in order for cases to start climbing and for people to start getting sick with multiple exposures. So that could fill up very fast. There's also the possibility that if one area of the state becomes overwhelmed, that they would need to transfer patients to another part of the state. So we want to make sure that our healthcare workers stay safe and protected, and that our hospital system is not overwhelmed. We also want to keep people healthy, and in order to do that, if we would, I think that the most important message is to be personally responsible for our own choices and to care about others, to care about not transmitting the virus, even if you don't think it's really gonna do any big deal because, we've been going through this since March, and hear people say I haven't gotten sick, I'm fine, I haven't been wearing a mask. You've been lucky. As the cases climb, we need to all continue to do our part with hand washing and mask wearing and social distancing, and that's really, if all of us wore masks, the majority of the time, 80% of cases could be prevented, and we could get through this quicker. What we don't want to see happen is things starting to shut down again. In order for businesses to stay open, businesses can do their part in making sure that their customers and their employees are wearing masks consistently, and to set a good example as community leaders, to show that, regardless of whether we think we're at risk or not, others may be at risk, and that this is a virus that doesn't care about, what we think about masks or politics or anything else. So this is how we can get through this pandemic.
Thank you, Nancy. We'll next check in with you after the Thanksgiving holiday. So till then, both you and those watching, we wish a very happy and warm Thanksgiving too.
Thank you, and I want to wish everybody a happy Thanksgiving, and to, think about that as you're gathering with your family and friends, to please try to limit the number of people, and use these prevention measures. And next time we'll be talking about our plans for testing.